Hi, and welcome to the 4th episode of the My Breast, My Health podcast. Every 2 weeks, new episodes come out which covers various topics related to breast cancer and health. Some of these may be solo episodes, like this one today, but others may involve me interviewing either an expert in the field of medicine or someone who has been affected by breast cancer and has been generous enough to share their stories. If you feel that this is something you may enjoy listening to, then please subscribe to the show. Now, I have seen hundreds of women and some men in my breast clinic over the years, and one of the commonest recurring comments that I hear is that many people don't know how to examine their breasts confidently. They don't know when to do it, how to do it, what to look out for and feel for, what feels normal and abnormal, and so on. So in this episode, I will guide you step by step in how to examine your breasts the correct way. If you've ever wondered how to do this, then please stick around as this is the episode you need to listen to. At the end, I will summarize the points that I go through and will let you know also where to get more information. The beauty of a podcast, of course, is that you can pause it if you need to, so please feel free to follow me step by step so we can do this together. Firstly, you will need to undress from the top half including your bra. If you're a man, then this won't apply to you. Then stand in front of a mirror so that you can see the top half of your body. This part of the breast examination is the looking or inspection part. Place your hands on your hips and look at your breasts in the mirror for these things. 1. Are there any obvious skin changes or rashes? Do you see any redness, skin texture change, or eczema-like skin changes, especially around the nipple area? 2. Do you see any dimpling or puckering of the skin? What I mean by this is that the skin is kind of drawn towards the breast inwards. 3. Look at your nipples. Do they look normal or are they retracted and going inwards? This can be quite normal, but if it is a new thing, then it should get checked out. Also, have you noticed any staining of your undergarments, which may indicate the presence of spontaneous nipple discharge? 4. Are there any obvious changes in the shape or contour of the breasts? Then raise your hands up behind your head and keep looking out for those points I have mentioned. Sometimes skin dimpling or puckering can be more pronounced with the arms raised. If your breasts are slightly droopy, you will need to lift the breasts to expose the lower half of the breast. So make sure that you don't forget to look for the changes I've explained earlier around this area as well, as it's very important that the whole of the breast is examined. Once you've done this, then the next step is feeling or palpation part of the breast examination. You can do this either in the shower while standing up or lying down on the sofa or bed, wherever is convenient for you. Now people ask me, what am I feeling for? And the answer is that you are feeling for lumps or an area of fullness that is more obvious compared to the other breast, or any new changes in the breast that you haven't noticed before. The best way to examine your breasts is by using the flat of your fingers. I've seen people pinch the breast or prod the breast, and I would encourage you not to do it this way. Examine your breast as if you're putting moisturizing solution onto the skin, and that way you remember to use the flat of your fingers. If you're examining your left breast first, place your left hand behind your head. Then, with your right hand and using the flat of your fingers, lightly examine your breast. In your mind, divide the breast with the big cross into 4 sections, and then step by step with a light touch in the first instance, gently feel the surface of the skin of all 4 sections to feel for any lumps or bumps. Once you've done all 4 sections, then go into the center and examine the nipple area. Then repeat the whole process, but this time examine the breast by pressing with a little bit more pressure. By doing this, you will feel deeper into the breast. Once you have finished examining the breast, go into the armpit and feel for any obvious lumps. Once this is done, repeat the process with the other breast. So, for the right breast, raise your right hand and place it behind your head, and then examine your right breast with your left hand. Don't forget to examine the nipple area and the armpit. This is how you examine your breast. It is simple, and you can do it within a few minutes. A common question I get asked is, I don't know what I'm feeling for when I'm examining my breast. So the breast is made of fat tissue, ducts, lobules, fibrous and glandular tissue. A young woman's breast is quite glandular, and so it can feel a bit lumpy. As we age, the breast becomes more fatty and feels less lumpy. So a degree of lumpiness is somewhat expected. Lumps, however, can actually be quite obvious to feel on the whole. Sometimes they can be round and movable. However, other times lumps can have less defined edges. They can be rather firm to feel and not particularly movable. Lumps can also vary in size, from a small pea size to maybe a Malteser size, to sometimes anything like a golf ball. Other questions I get asked is, how often should I examine my breast? Well, you should examine your breast regularly, about once a month. If your breasts get quite lumpy and swollen before your menstrual cycle, for example, then wait until they return back to their normal state. Now, don't worry if you forget and miss a month. The most important thing is for you to get to know what your breast feels like. The more often you examine them, the more familiar you will be with what feels normal and what doesn't. The take-home message is that if you find any lumps or new changes in the breast that you are not sure about, then get medical advice and go and see your doctor to get them checked. So, I hope this step-by-step guide to how to do a breast examination has been helpful, and that now you'll be able to examine your breasts with more confidence. Let's summarize the important points. Stand in front of a mirror and with your hands on your hips and again behind your head, look at the breast for the various changes I've outlined. Then, palpate or feel the breast with the flat of your fingers and make sure you examine the entire breast by systematically moving from one section to the next, not forgetting the nipple areas and the armpits. If you would like a recap of this episode, then visit the show notes at www.mybreastmyhealth.com/breast examination. This will remind you of all the things you need to look out for when examining your breasts. If you would like to be notified of future episodes, then hit that subscribe button so that all new episodes will be automatically downloaded to your podcasting app of choice. And if you have enjoyed this episode and found it useful, I'd be grateful if you could leave a review on Apple Podcasts, and this will help expand the reach of the podcast so that other people can discover it and hopefully benefit from it as well.